Welcome to Wellness Must. I'm genuinely glad you're here because today's conversation is one I have been looking forward to for a long time. We are going to travel through thousands of years of human curiosity, from ancient physicians observing cold water on wounded soldiers to Roman bathhouses to a 19th century priest jumping into a frozen river to laboratories in modern Japan, all chasing the same question: can the human body be taught to heal better? And what fascinates me most is this: the people who first asked the question had no technology, no labs, no imaging, no data, just careful eyes, curious minds, and the audacity to keep observing when something worked, even when they couldn't explain why. That gap between ancient intuition and modern science is exactly where today's conversation lives. Because what they noticed thousands of years ago, we are only now beginning to fully explain. And what we are discovering is quietly changing how we think about recovery, resilience, longevity, and what human body is truly capable of. So whether you're here for the science, the history, the performance, or simply because you want to understand your own body better, you are in the right place. Let's begin. Welcome to our podcast, Dr. Shah.
Thank you.
So we met Dr. Shah in Arab Health Longevity section where you were the host.
Correct.
And then we keep hearing about you everywhere, and we saw you're really passionate about longevity, wellness, though you are interventional radiologist, right?
Correct.
So we want to know, and my audience want to know, what shaped Dr. Shah to reach here, because everybody has their journey, and we would love to know your journey from your side. Yeah.
Okay. So I'm actually a neurointerventional surgeon. I do minimally invasive brain and spine
Amazing.
surgeries, which we do with under CT guidance and fluoroscopic guidance. But I got into this because I got into pain management. So pain management and regenerative medicine are very connected. And if you see now, like they have the TOBI conference in the US, which is a big orthobiologics. And it's usually started from joint pains and spine pain that we started treating. We started doing PRP in discs, and we started putting stem cells in discs. Now we're putting exosomes in discs. And also for pain-related things. So for the nerves, we would do different injections. For the joints, we would do different injections. So for me, it was a natural progression from the pain management, neurointerventional side into the regenerative medicine space. And then I continued, and I happened to be at the right place at the right time when stem cells were kind of first starting. This was probably around 2008. And we actually...
very long back.
So I went for training in Turkey because so in terms of countries that are ahead of in stem cells, Thailand is very far ahead, right? So China is very far ahead. Turkey was very far ahead at that time. And then probably Iran is also very far ahead.
Really?
Yes. So the Iranians are actually ahead because of necessity. Because of the sanctions, they could not get pharmaceuticals. So they had to find other ways to treat their patients.
Wow.
And they didn't have pharmaceuticals. So they started using regenerative medicine. And the Royan Institute in Tehran is probably the most prolific publisher of stem cell papers right now in the world.
Amazing.
Yes, Dr. Shah. We will start with photobiomodulation.
Sure.
Right. So I just want to say some background of the photobiomodulation. So ancient Egyptians were the first one to document using sunlight to treat certain condition. Then Greek, especially Hippocrates, promoted heliotherapy using sunlight for healing. And then there was a Danish physician who pronounced light therapy for skin diseases. And he won Nobel Prize, right?
Correct. So that was in 1905.
Exactly.
They were treating extrapulmonary TB. So the TB that, of course, there's always the TB gets in the lungs, but there's also extrapulmonary manifestations of TB, including the spine.
We know.
We've all heard of Pott's spine. We've all heard of TB skin diseases. So in 1905, they awarded the Nobel Prize to him for treating TB that was not in the lungs. And it was doing very good. And so You have to understand heliotherapy, as you mentioned, solar therapy. The Egyptians used, the Incas used, the Mayans used, the ancient Sumerians used. The Romans had their actual solariums. So this was a very common. We knew that light can heal, but it was not until there was a Dr. Meester, a Hungarian doctor, who had a mouse, and the mouse had an area of hair loss and cancer. Because of the cancer, he had hair loss. And he was shining some kind of light on that area, and he noticed that the hair grew back. And so what he realized was that light is regenerative. Light actually causes regeneration. And if we think about it back to the cell side, if you remember your cell biology, remember your plant cell biology, you had chloroplasts. And chloroplasts can take energy, light energy, and convert it into chemical energy, right? So that's your photosynthesis process. Well, guess what? The human body has the same equivalents. All the organelles in plant organelles are also in human organelles. And the equivalent for the chloroplast is your mitochondria. And so most of the photodynamic therapy or photobiomodulation therapy we use is really based on the energy process inside the mitochondria. And so if mitochondria start working, your cell does much better and regenerates. If the mitochondria die, that's when cells start dying. And that's when most cell processes, if we see apoptotic processes or other cell death and through necrosis, it's usually that the mitochondria start not producing enough energy and that cell dies.
Amazing.
If sunlight shaped human biology for more than 300 years, why it took for modern medicine, they
long.
ignored
Yes.
this fact?
Yeah. So, Dr. Gaz, I think you have an excellent question, and I don't think it was ignored. I think certain areas, so for example, the North American model of medicine and the European model started ignoring it. But in other areas, it was used still. And I can tell you, light therapy, the Chinese have been doing it for ages, and they actually could refract the light into different wavelengths. But it wasn't until Meester and his experiments with the mouse, then the Russians, this is a very interesting part, the Russian Military Medical Institute started working with light. Now, initially what they were doing was they were doing UV light, and they were doing an external circuit. So they had an external circuit. It would go out tubing, and it would go from artery, through an artery, to the vein, and go back. And in that middle somewhere, they would put UV light. And they would shine
In the blood. You're saying like
on the
blood is being exited.
Yeah, so the blood in a clear plastic tubing,
Wow.
they would put UV light, and they noticed that it would improve the patient's functions to the point where, of course, the Russians, the military guys, were very far ahead, especially their...
Actually, Dr. Ayaz and me were reading about
Yes.
all the Russian experiments, and we discover a lot of stuff.
Yes. So peptides come from the Russian experiments.
Yeah.
Bioregulators come from the Russian experiments. Photobiomodulation comes from it. Photodynamic therapy comes from all those experiments, because the Russians at that time, the Soviets specifically, were trying to fight the Americans, and they wanted
It was a third
Yes, it was
World
a cold-
War.
yeah, it was a Cold
It was
War.
Cold War, and
Right.
people were like, they were just experimenting to take edge. And we saw about the athlete also.
Yes.
Yes.
Yes. Yeah.
What if the depression, inflammation isn't a disease, it's a deficiency of light?
Right. So
Possible.
this is a very interesting theory, and people have this theory that when people don't get enough light, well, then your vitamin D goes down, your inflammation goes up, and diseases are more prevalent. But when you get more light, we know, and you see it. You can see it if you go to the Africa and you see where small children, or even India or Pakistan,
They're
where
so
kids are playing out in the
healthy.
sun.
Yeah.
Those are the healthiest kids.
Exactly.
One, they're exposed to lots of bacteria and viruses, fungi, and so their immune system is very strong. Then they get light therapy. Then their vitamin D is very strong, right? So then their immune system is
Exactly.
strong. Those kids are very hardy.
I think light is really therapy. You see, in northern countries, there's something called cold depression. So we know light has something to do with the healing. And if you see Africa, their bones,
Much stronger.
they don't have osteoporosis and all those things. Their muscle strength and everything is better. But
Yes.
those people, when they go to North America and become African American, so they don't have the same. They have more diseases and they're more at risk because of
Yes.
the changing environment. Amazing.
Can we dial back cellular aging with the light, putting light on the mitochondria?
Yes, so 100%. And I can tell you, and I'll give you a very good example. So we have this crane. There's a very nice device called the Weber cranial laser, and that's used for intracranial process, for the brain process, for regenerating brain.
The one you were telling.
Yes. So what we now we have to put a warning on that,
Right.
because what happens is people who put it on and they have hair loss, their hair grows back.
Wow.
So the hair follicles, the original hair follicles, regenerate, and so we have to tell them you're going to get your hair back, and it's going to be
that's a nice
it's
thing,
going to
no?
be the original color.
Oh.
So if you whatever color if
Yeah.
you colored it, it's going to come out a different color. So we have to give that
But
warning.
their
now.
color may also improve.
Yes.
Like somebody having white hairs and
No,
dying.
they'll come back. No, they don't come back black. Or if it's
They will
black,
come
or-
original
they'll come
color.
the original color. So
and
that's why we have to
whatever
warn
the
them.
color their existing hair has changed, they will also revert back to
Yes.
normal color.
Yeah. So again, the
Amazing.
follicle, the hair follicle, will start to regenerate. All the little cells inside the hair
Wow.
follicle that creates the hair cuticle.
So when me
will
and Ayaz
regenerate.
are trying this, your device.
Yes.
Yeah. So two people with same age,
Age.
same diet, one looks 40, other looks 60. So could it be the exposure of light that affects?
So there is, understand, just like anything, there's a dosage. And if you increase the dosage, you have to stay kind of in the middle. And you see, and we've all seen people who spend too much time in the sun and their skin is very dark and they get photo aging. Now that's different, right? That's a too much exposure, and they're getting exposure to UVB and UVC. What you want is the more healthy UVA light, right? So this is why when I tell patients, if you're going to get sun, go out early in the morning or late in the evening. Don't get the direct sun at 12 to 2. That's going to be more damaging light. So again, light has different spectra. It has different energy wavelengths. You have to kind of choose carefully. And what's really great, whoever you believe, I believe Allah subhanahu wa ta'ala is the creator, but
definitely.
He has created the way your retina is, that your retina will absorb the light at 6 in the morning better than any other light time. Because the angle that the light comes in, right, because it's still a shallow angle, comes into the retina, and those cells, the retinal cells, get exposure. And what's amazing is you have a pineal gland. Now, the pineal gland has light receptors. Now, the pineal gland, if you know, is deep in the brain, right?
Yeah.
It's near the thalamus, very far in the brain. So the question would be, well, why is there? Well, guess what? Because when you get the light receptors on the eye, they go through the optical tracts, and guess where they end up? Near the pineal gland. So that energy is transferred. So it's an amazing system. If you look at the
Also,
engineering,
circadian
Yes,
rhythm
Yes.
has
circadian
a
cortisol.
role, and like
Yes.
your metabolism of the same food is different with the
Yeah,
light.
in
of course.
circadian rhythm, like morning cortisol level
Right.
increases that make you wake up.
yes,
So this is the reason you
And
go
even the
outside.
metabolism changes.
yes.
Definitely.
So
yes.
it's amazing if you think about it. Somebody engineered this body to want sunlight at a certain time period, right?
Yeah.
And that's why if you look in certain religions, you have to wake up at a certain time and you have to pray at that time, and you should stay awake until the sun
we don't.
rises, right?
Yeah.
And then you get the sunlight at that time, right? So
And
it's
then
amazing.
they say breakfast like a king, and that
Yes,
thing. So
yes.
yeah, amazing.
So if mitochondria produces 90% of our cellular energy, why doctor are not asking how your mitochondria
Yeah,
are working?
it's really surprising. Like we have all the clinics, big hospital, and we don't talk about mitochondria enough.
Yes. No. So there is now a specialty called mitochondrial medicine.
Is it?
And yes, and like we were talking about peptides,
Wow.
like MOTC and some of the other peptides are mitochondrial peptides.
No, but it's not a speciality yet.
Well-
it's just, I mean, there are some institutes
well, no, but
they're
there's
giving.
those full conferences, right? Now there's a full
Yeah.
conferences.
Yeah, but still, there's no degree, there's no speciality. It's like you, me, Dr. Yaz, we all, like, because of our own special interest, we are reading, but there's no speciality yet.
Yes, I think just like regenerative medicine started off as just simple PRP, we moved on to stem cells and these kind of things, and then it became regenerative medicine, right? Because it's a all-encompassing field. The same way I think mitochondrial medicine, you will see people are now discovering, okay, so these are the pharmaceuticals that work for mitochondria, these are the peptides that work for mitochondria, this is the light energy works, this is the resonance energy. So we know that resonance also, right? Bioresonance is a new type of therapy used for helping with mitochondria. So the same way you'll see mitochondrial medicine is developing, you see conferences now on mitochondrial
Amazing.
medicine, and eventually I think you'll see a specialty where it will tie to everything, right? Longevity, cancer. So we know that cancer, a lot of cancers, what happens is the mutated cell their mitochondria become super energetic, right? And that's why they start taking glucose. That's why you can see it on a PET scan.
Yeah.
Because those tumor cells are become little powerhouses, and the body in its immune surveillance should pick up on that quickly. So usually your immune system will see, oh, this is a mutated cell. Okay, let's kill this cell quickly, and your macrophages or your dendritic cells will come in and take it apart. But that again has to do with mitochondria. The more mitochondria you have in your body, guess what? Your immune system increases. Your immune surveillance system increases. And so I always tell people, the most powerful chemotherapy is your own immune system. You have 6 to 10 circulating tumor cells in your blood right now, all of us. And guess what? Your immune system sees the mutation and says, okay, well, this cell should not be here. Kill that cell. And that's just your circulating. It doesn't count how many tumor cells you have in your solid organs. So if I was to measure your whole prostate, take it all out, your whole breast tissue, all the gynecological tissue, all your endometrial tissue, and look, there's going to be mutated cells there.
Of course.
But those mutated cells get taken care of like that immediately because your immune surveillance.
So do you think this photobiomodulation also take care of those cells?
Oh yeah, so we have an actual photodynamic therapy.
So it is preventative, not curative.
No, it's
right?
both. So it's both. It will work both for prevention. So if you take photobiomodulation, and I take it regularly, right, and I'll do the treatments with
How
the
frequently,
intravenous.
by the way?
So when I have my machine, where my machine, I do it once a day sometimes.
Yeah.
Especially the days that I have energy or I need to do something. Yeah.
Is it safe that?
Yeah. No. So
Because it causes injury.
No. So it depends which wavelengths you use. So
Yeah.
so our machines have ultraviolet, infrared, blue, red, green, yellow.
So
All the
different
wavelengths.
lights for different purpose, right?
Correct. So for example,
But
yellow
which one
light.
can be given regularly, daily?
Yeah.
So yellow light is probably the most benign of all of these ones that
So
has
you
the least
take
effect.
yellow daily.
Yes, and guess what yellow does? It helps depression.
Whoa, great.
Yeah, so depression you can treat
I'll try.
with yellow light. Yes, and if you add St. John's wort and the hyper,
But that's increases metabolism of the liver.
Right, so you can. So there's different things that you can do. I mean, you have to study this. You have to know which agents you're putting in. But even like chemotherapy, we have certain chemotherapy drugs we can use smaller doses. We don't have to have all this, big systemic side effects. We can actually inject the chemotherapy agent directly into the tumor, and then shine light at a specific wavelength that affects that specific chemotherapy agent. And guess what? Now it only kills the tumor cells. It leaves the good cells alone. So,
Wow.
So it's very amazing what we can
It's
do with
a
with
huge
light.
implication and
Yeah.
in
And if
multiple-
it's selective, that's really amazing. So we talk all about the heat. I think we cannot
Yeah.
leave the cold. So recently, Dr. Ayaz and me, we went for cryo. It was amazing experience. We love it. So this cryo, it is born out of the wellness and medical practices. So Hippocrates, father of medicine, he said cold as a part of healing. Then ancient Romans used to use cold baths, and then in 19th century a German priest used the whole system of the cold therapy, which I think Dr. Ayaz will tell more about it. Then in late 1970 a Japanese scientist who made the whole system of the cryotherapy. Yeah.
So every major civilization on Earth, without talking to each other, they started cold therapy. So what does that tell us about human body?
Yeah. So I this is my theory that a lot of this knowledge was given to us by whoever. We'll leave
Ancient
it blank.
people.
We'll leave it that
Yeah.
part
Yeah.
blank.
Not with the explanation
some people
and
say
science.
ancient people, angels, prophets, whoever, different.
okay.
So different civilizations had
Yeah.
this knowledge in separate places, but it was very similar. So, for example, with cold therapy, there's something called cold shock proteins, right?
Yeah.
So cold shock proteins will help
I know
your immune
heat
system.
shock proteins
Both.
from the Swedish
Yeah, so you have
study.
So you have heat shock proteins
That is
and
by
cold shock
Sona?
proteins.
Wow.
And if you use both, right, then the body becomes heat resistant and cold resistant.
And
right?
these are
and you become
also-
stronger.
Yeah.
Yeah.
Wow.
So this is this goes
So
back,
does
now,
it-
this
does
goes back
it-
to the Russian experiments, right? So the Russians, after they did photobiomodulation, then they did peptides, then they did bioregulators, then they increased their nutrition, then they started doing the photodynamic therapy, and they did heat and cold therapy for their soldiers. these guys became incredible. Their chest walls actually increased in size because their functional residual capacity and total lung capacity increased 10, 20, 30%. Their cardiac output increased 25 to 30%.
It's
Their-
been scientifically proven.
Yes, no, their red cell muscle mass and their fast twitch fibers.
Wow.
So their fast twitch fibers and their red
They're
cell
very
muscle-
important to
Yes.
prevent you from fall.
Right, and they become stronger, right? And then when you put the heat shock and the cold shock therapies, well, guess what? Now you have these super soldiers. These are like amazing guys who are
They do
bigger,
exist.
stronger, faster, and guess what? Neurocognitively, they're faster. They think faster, so
Winter
they can aim
Soldier.
a gun faster. Yes,
Also,
so they
it
can
is
shoot faster.
Captain America.
Yeah, no, they're like so. They're
Also,
like
yeah.
so,
Yeah.
yeah. But these guys,
Hulk.
yeah, these
I think Hollywood got
no,
inspired
Hollywood got-
by
yeah,
that.
Exactly. No, these kind of things, these experiments are what Hollywood, with Hulk is a military experiment, right? Captain America military experiment. These guys were really doing this. And I can tell you, because the Russians do this, one, they used to win at the Olympics a lot, right? And
Yeah.
they was, they're doing
Yeah.
this, they're doing steroids. And, no, they were
And
not.
So
we
in
were talking.
Second World War, this was the those who win the more gold medal in Olympics,
with
they
the-
were
yes.
showing the political strength and
Yes.
power.
Yes, it was a power. And,
Yeah.
and I'll tell
And
you.
an impression also.
Impression.
Just in case you're going for Third World War.
Yes.
Look at us. We are winning here. We
no,
can win there too.
And they have special forces competitions all over the world, right? Where the special forces from the UK, from the US. So like in the US, you have your SEAL team, you have your Rangers, you have your Delta Force. These are those special forces. In the Russians, they have one. It's called the Spetsnaz. And on the space side, they have the cosmonauts. Of course, the Americans have the
Cosmonauts.
astronauts, right? So
I was just,
these would compete, and guess what? The Russians win every time, both at speed, both at agility, both at aiming and hitting targets,
Wow.
both at resistance and fighting.
Wow.
It's just amazing, and all
Also,
from these
they
kind of
were
therapies.
increasing performance because for cosmonauts, it was very important time. They can be in depression, stakes were high, and decisions could be lethal and fatal. So they used to take performance enhancers also. I think ashwagandha also coming from there. And I was reading some more stuff there
So
also.
the Russians were way far ahead, and even now, some of the stuff that we're doing now. I mean, just now we're starting to use bioregulators in Western society. They've been using it for a long time. In fact, the reason these endolaser and these machines got built because the wall fell.
They were using, but it was not coming out.
Right. No. So
So-
what happened was when the wall fell,
Yeah.
all these Russian people they
1991.
they migrated to Germany,
Yeah.
and they started asking German doctors, "Hey, I want the light in my vein." And the German
Yeah.
doctors like, "You
Yeah.
want what in your vein?"
Even
"No, I want light in my
scientists
vein."
moved,
Yes.
and documents just got slowly being shared.
So what happened was this was interesting. The German government at that time was a little bit forward thinking. They found this Dr. Weber, and he was getting all these Russian patients. So he said, "Listen, let me go to Russia and investigate." So he did. And when he investigated, he saw the machines. So he came back to the German government. He said, "Listen, I can build this machine," because he was a chemical engineer because of his
Wow.
engineering mind, and he was a doctor at the same time. So he used an engineering mind to build this Weber endolaser. I mean, nobody ever thought of putting an IV laser fiber into your veins.
Wow.
And I've been doing it now in the arteries.
Yeah.
So I do in transarterial, either ultrasound guided or fluoroscopic guided, where I can put the catheter and the optical fiber into the artery.
Artery.
Yes, and then now you have full blood circulation going past that optical fiber and fully getting irradiated with whatever wavelength of light we choose.
Is this for some blood purification? Or
Yeah, so
what?
no, so interestingly, so I was at a conference in Dubai, right? And one of my friends, a very prominent neurosurgeon, he came and he called me up, and he's from the US, and he said, I'm coming here, I want to go to see this conference. It was a cardiology conference. We went there, there was a Russian cardiologist there, and he showed us a CT scan, right? Normal CT brain, right? Then he showed a big infarct. And if you've seen an infarct, it's like melted brain. We call it encephalomalacia. Big black wedge-shaped area brain. And then he showed the same patient 6 months later, completely normal CT. And we said, so I of course, I antagonized him a little bit. I raised my hand. I said, I think that's not the right same patient. He goes, what? What? You don't think this is a... He said, who are you? And so I said this. So then I speak Russian, right? So I go, понимаю русский язык, да, хорошо, товарищи. So he's like, да, понимаю русский язык. I'm like, yeah, I speak Russian. So I started talking to him in Russian. He says, come here. He showed me the CT scan, and it was the same patient. And I was in shock. And I was like, how do you do this? He goes, You come to Moscow. He said, come to Moscow. I'll show you.
So what exactly therapy was that?
So he was putting this laser
Laser.
fiber into the brain through the arteries because he's a cardiologist, right? So he can go into the arteries of the brain very easily. So he was putting a catheter
But
and
is
a
it
laser
ethical,
fiber.
all of it?
What do you mean? So understand, this is all experimental stuff, right? Everything's
Yeah.
experimental. So he was doing this and he's putting this UV light in the brain and he was getting regeneration of neural tissue, which we have always been taught in medical school. Brain tissue, spine tissue never regenerates, right? That's
Yeah.
the dogma. Not
Exactly.
true. Not true at all. And this, you have stem cells in the brain. And so this guy was regenerating brain. I didn't believe it, of course. And I said, okay, I'm going to come to Moscow. So I went to Moscow, got there in the middle of winter, and the Russian guard at the military medical institute, he goes, do you have security clearance? I'm like, no, I don't have a security. I have an email, bro. No security clearance.
Yeah.
He goes, you cannot enter a military medical institution. So then he made some phone calls. Finally, we called the military commandant. They talked to the scientist guy, and he said, yeah, Dr. Shah is here to visit me from Dubai. I went there. He showed me 500 studies. MRI, CT scans, PET scans. So the tissue eventually became functional. But what he said
So
was,
what exactly
have-
that laser is doing?
so it's UV light. So understand, you have circulating stem cells in your blood all the time. So what's happening is he was putting the UV light, it was stimulating the brain, and then the stem cells would go in and then recreate the brain. And so you were getting brain
So
tissue being built
externally
again.
you are putting stem cells through
Yes.
that catheter.
No. So this was his own, because these were mostly young patients. These were military people, right, who were already in good
Yeah,
shape.
they are young.
Yeah, so he was doing it on yes, and they're strong too.
Yeah.
So they have high stem cells, and their stem cells are very functional. So what he was doing was by accident. I mean, he was doing the UV light in the brain, in the vessels, but the stem cells were getting the energy also. So they would go and fix whatever part of the brain that was damaged.
Very nice.
Yeah, and so amazing. So then I asked him to show me the exact catheter.
Yeah.
And he would not. And I should show me the wavelength. He would not show me. So finally, I did some animal experiments myself, and I found out it's UV light mostly, but you can use. But now because we have the other wavelengths, so now right now I'm building a prototype. We've actually built 3 in India right now,
Amazing.
where we have the prototype catheter. We can put it anywhere in the brain, and we can shine all wavelengths of light.
Does it have to stay inside too, or
No, it's only there for a few minutes.
by intervention or
10 minutes,
radiologist?
yeah.
Like,
So I put them in through the catheter, put it into the brain, and for like 10, 15 minutes, and then I inject our own stem cells. So I inject more stem cells in, and we've had some amazing results with that.
Wow.
For even patients who've had a very, very serious brain injury, we can get their brains back. And for the young kids with like autism and other neurodegenerative problems, cerebral palsy kids who have that hypoxic damage, we can regenerate parts of their brain.
So when this Third World War or the Cold War was happening, they were actually accidentally building up longevity medicine
Yes.
and the
And wellness
wellness.
medicine.
Wow.
Yes.
Amazing.
No, and you have to understand, a lot of our medical therapies, antibiotics, surgical techniques come from war, right?
Amazing.
Because through battles and through things, we learn how to fix people better and faster.
Amazing.
So in 19th century, there is an example. There was one priest. He cured his tuberculosis by jumping into the frozen river. So and he was like cured, and into a medical system that still exists. So how it works, like
Yeah, so I think so. The primary again, I think it always comes back to your immune system.
yeah.
Your cold shock proteins, when you use cold therapy, whether it's Wim Hof method of immersion into cold water or whether it's a cryo unit that athletes use now. So, you know, a lot of the FIFA athletes and the NFL and MLB athletes have these cryo chambers in their house. And they go in, what happens is, so there's a few things that happen. But one, you get repair quicker. So your cold shock proteins increase with the cryo. When your cold shock proteins will increase, your nucleus will start responding to those cold shock proteins and start regenerating and start repairing. So the body senses the cold. It says, okay, this is a adverse environmental effect. I need to repair. Exactly. So the body starts repairing much faster. So if you have MSK injuries, small ligamentous injuries, even skin issues, you can get them repaired much faster with the exposure to cold. So basically, if you think of it this way, the body responds to whatever stress you put on it. So sometimes inflammation is not bad. You know, we always think, inflammation,
Yeah.
we always say, inflammation, and we say all these words. But sometimes,
Amount of inflammation is
exactly.
important.
And this is what all the ancients realized. that if you put the body under a small amount of stress,
Stress.
then it repairs. So, we used to do, you might have heard prolotherapy. Prolotherapy was injecting of dextrose into joints or ligaments or other things, and you would actually cause damage, but a very small amount of damage, but then the body would sense the damage and repair it, right? So the same way we know through different environmental stressors, the body will repair. So this is why in ancient cultures, fasting is very common, right?
Yeah.
Fasting for long periods of time, going without water, or doing other things, heat, cold, exercises. Like you look at the Buddhist monks or the Shaolin monks, they do very severe, extreme exercises with their bodies. And what happens, they cause a little damage, but then they figure out ways to repair. And they always rely on sleep. Right, so all of these ancient.
So these heat shock proteins, does they have effect on immunity also? or-
Yes, so exactly. So I think a lot of it comes back down to the mitochondria and the immunity. The heat shock and cold shock proteins will stimulate the mitochondria and stimulate the immune system. And once the immune system is there, the immune system is your primary defense everywhere, right? Whether it's in the skin, whether it's in the mucosal membranes, whether it's anywhere in the blood, your immune system is what really protects you. And I'll tell you, God has produced the most amazing immune system possible. It's ready for anything.
Yeah, around 1970 in Japan, there was one physician, and he saw one patient with severe pain in arthritis. Then it came to his mind that why not we should give him some cold minus 110, and that was also it worked. So what was that idea? Which
I think remember when we do our medical school physical examination, when there's a joint that's deranged or pathological, we always check and we see it's red, it's swollen, it's
Signs
tender,
of inflammation.
the signs of inflammation, and we put our hands on it. So obviously we put cold on the joint, we know that we can reverse things. The same way the cold will reverse. So when I do a procedure on patients, I always tell them for the first 24 hours, if I do a joint, I say put ice on it. Or if it's an injury, I say put ice on it for the first 24 hours. And you'll see trainers on in the professional sports, they always ice whatever the injury is first, because ice will decrease the amount of damage that's happening, right? So it will prevent too much inflammation from occurring in that damaged area. So the ice helps, right? And it also stimulates the immune system. So now your immune system will come in and start, okay, there's all this damage here. Okay, it'll send out a homing signal. The homing signal will then tell stem cells, okay, you know what? You guys need to come in and do some repair, especially like Muse stem cells, right? Yeah. Which are cells which can both repair and they can also replace, right? So they can actually come in and engraft themselves and become the tissue that you want them to become.
Same as cooling therapy for newborn, when they have asphyxia and lack of oxygen.
Right.
And if cooling therapy not there, there will be brain injury.
Yes.
That's amazing thing,
Yes.
honestly.
Yeah.
And that
Yeah.
is very relevant to us because, fetal outcome and it's so important.
Yeah, when you have APGAR scores and you're measuring the baby and you're seeing the
And we are
outcomes
not
and you're seeing-
gods.
Yes.
Things can go wrong, and then we have something to protect the baby. And
Right.
at the
and
end of
protect
the day,
brain especially, right? I mean, that's the biggest thing. You want
and
to
the
protect the brain.
parents have to live with that child forever. So for us, maybe it's just one night or one outcome, but for parents, it's a whole
Lifelong,
life.
yeah.
And also in the cardiac arrest, I think they have something like that.
Cooling therapies,
Somebody,
yes.
exactly. So somebody who just had cardiac arrest and physician are able to begin their heart by CPR and defibrillation. So they do the cooling therapy
Yes.
also to
So for
protect
stroke,
the brain injury.
heart injury, for cardiac arrest,
Amazing.
for stroke, we will often cool the body to prevent more damage from occurring. So we'll kind of try to freeze the body in a kind of state of suspended animation, basically, right? Yeah. By freezing, we prevent more things from going wrong and more damage from occurring. And then when the body's ready to repair, then we will revive the body again. And we all heard the story about that young child, I think it was somewhere in Poland or somewhere in Nordic area, where the child was drowned in cold water, and for almost 2 hours, the child had no cardiac activity. And they were able to warm him up and cool him, and he suffered no brain damage, despite the fact that his brain got no oxygen for almost 2 hours.
Yeah.
So the body has, and we have a diving reflex, and we have all these reflexes in our body that are made to do these kind of things. We just have lost some of that knowledge. And I think actually, if we start studying ancient medicine, we discover a lot of these things were already known, and they had been using them. They just didn't understand the science behind it, but they knew that it worked.
Yeah, amazing.
So still I will be at the core. It's very important topic we are discussing. So when we are doing cryotherapy, all of a sudden your body touches minus 110 degrees centigrade. So surprisingly, your system doesn't shut or you cannot die. What exactly happened at that time when your body?
Well, when you go in that
is
cryo
exposed?
chamber, and
Yeah.
and I've gone in like almost 10 times, and I keep on increasing my cold level, right?
So how much?
So I've been to 160 now.
Oh, but
Oh,
if less than 140 is not recommended.
Right.
And
I know,
for
I
how
know.
long?
No, but understand. I started at 90, 100, 110,
We've
minus
been
130.
110, right?
Yeah.
Minus
No,
1.
no.
Yeah, usually
130.
120 you're not allowed.
130.
Yeah, you're not usually you're not supposed to
Yeah,
go bar.
2 minutes,
No,
yeah.
but I keep on building my resistance.
Wow.
Right? And I've determined that when I do that,
But this is the question.
Yeah.
What's the
What
boundary?
yes. So no, I think it's a matter of so just like we talk about dose, just like this, you have to do everything graduate. You cannot do it automatically. Go to the 160.
sudden.
And even with the astronauts and even the spetsnauts and all these guys, when they started doing this, they would start slow, and then build them up. The same way the body, will respond, but you have to take it slowly. You can't all of a sudden shock the body at 160.
And they
That's
give
too
you
much.
gloves also because
Protect your hands,
still
your gloves, and your
like
socks.
terminal part which can just
You
have
can still get
frostbite or
yeah.
something.
Yeah,
Yeah.
you get frostbite and you get ischemic damage, right?
Exactly.
So I know when we do
So
angios,
terminals have to still be protected with the right protection, right care.
Yeah.
It is still doable.
yeah, because those are end arteries, right? And those little end arteries will not get good circulation at the end. At the end of it.
Exactly.
So they will
So
protect those end
they give
arteries.
gloves to wear to
Exactly.
protect
Yeah.
those.
But the
arteries.
core of your body will always keep itself warm, right?
Yeah.
The core will pull heat and pull blood from other places to keep your heart, lungs, and your brain working.
And they recommend to keep moving also. Maybe muscle will freeze.
Yes.
So, Dr. Shah, like when we do exercise, it tears, little bit tear up appears in our muscles.
Right.
When we do fasting, our cells, what is called
You have autophagy. Yes.
starves.
Yes.
And in shock, your system, in cold, your system goes into shock. But surprisingly, this all helps to increase our
Healing.
age. Increase our age. So, what is our body actually doing with this punishment that helps
like
us in
it.
increasing?
No, I
Edge.
think, and this is where you see in the ancients that they did this graduated. They did small amounts. So you would fast. You would start off with 1 day fast, 2 day fast, 3 day fast, and usually a lot of these cultures would have a water fast. So you could still have water.
Yeah.
Yeah.
So you're not allowed to eat. And we know for longevity, we know in animals and in humans, the best way to increase longevity is stop eating, right? Or eat less. We know every animal, you can increase that animal's lifespan by giving them less caloric intake every day. And the more you decrease it, the longer they live. So this is one thing, right? And then, of course, the Japanese also have this theories that your heart has a certain number of beats inside of it, right? So if you use them all up by, getting angry or doing this or doing that, it's bad.
Wow.
Right?
Yeah.
Yeah, so they believe this. So that's why they
Nice.
do nature bathing, right? They go into nature and they take relaxation and their heart rate goes down. And this is why they say if you exercise, right, your heart rate will get to, athletic heart rates are like 45 beats per minute. We would usually think of that as bradycardia.
Yeah.
But the athletes, the high performance athletes, their heart rate is 40, 30, some of them you see. And so that belief is that if you exercise and you put yourself in that kind of position and you do stressing, but you do temporary stressing and then you get used to it, your body gets used to it, you will actually increase your lifespan.
Amazing.
Perfect.
Now I think we will go back to this third Cold War, the USSR and USA experiments,
Yes.
and all this got released, as you told, like from the German scientist,
Yes.
or the investigative journalist.
Right. Well, it was a combination of the Hungarian guy who discovered photobiomodulation was regenerative, and then the Russians started using it, and then the Germans invented the machine. And actually, the German government actually gave money to this doctor to build the machine.
Now I'm just thinking, the people who are just using these all, isn't it unfair advantage? Say suppose I'm standing in laparoscopy and somebody standing in laparoscopy and doing long and doing everything precise movement just because they are having all those cryos and
Peptides,
peptides.
bioregulators.
Exactly.
No, so it is no. So
Are you using it all?
yeah, so no. So understand, all of us have always looked for some kind of unfair advantage, right? Whether it's
Yeah.
an athletic
Life
competition,
is like this.
Yeah, whether it's an athletic competition or whether it's in school, I can tell
But
you.
in athletic, this anti-doping laws, yeah, they're there.
Yeah, they made anti-doping
Yeah, so the
laws.
World Doping Association (WDA)
Yes,
has
WADA.
very strict guidelines on what
1999
you can
they
use.
came.
So you can't take Apogen or you can't take Neupogen or things that increase your cell counts and these kind of things. You
And it
cannot do that.
started with somebody who died, cyclist. I mean, they thought
Yes.
he was on amphetamine.
Yeah. But what you can do
Right.
is you can do high
Yeah.
you can do high
Can you
altitude
start these
training,
questions
right?
now?
No, you do it.
Oh, so you can do high altitude training.
You know, I am building this podcast. Will become his.
Good. No, so you can do high altitude. So the water has certain guidelines, but what you can do kind of let's say thwart the guidelines, but to get around the guidelines is you can do high altitude training, right? So
Yeah.
all the special forces do this even now, right? They go into the mountains,
Wow.
and that's why the Gurkhas, right, the Nepali fighters were so amazing, right? Because these guys lived in Nepal in a very high altitude, so their
Exactly.
oxygen tension and their hemoglobin was very different, and release was very different. So
Yeah.
they're able to last for 6-7 hours when
I
the
think
British troops would get too tired to
But
do
high
anything.
altitude has one more thing. Like you're always walking up like a slope, which
Acclimatizes
it's like
you.
a hit, like high intensity
Yeah,
interval
so
training. Like
you're acclimatizing to the higher levels where the oxygen tension goes down to lower, right? And so,
but
your
also
body
when you're
will-
walking up this slope, it's a hit. Like your cardiac activity increase, and
No,
then
it is high intensity training, especially
exactly
if you
it
do it
is.
faster. If you
They're
walk,
living
yeah.
high intensity training.
Right.
So when I have to do high intensity training, I just go upstairs and then my heart rate just increases. I stop, then I go up, then I stop.
Right.
So this is the way. This is the very definition of high intensity training. So for them, there are two advantages, right?
Right. And understand, a lot of this stuff, especially the photobiomodulation, I can tell you, a lot of the athletes use it because it doesn't come under the WADA guidelines or the hyperbaric chamber. So there's a very famous soccer player whose name I'm not going to say, but you all know him. Everybody knows him. We just got him his own very luxury hyperbaric machine. And as soon
Wow.
as we got him it, the IPL guys started calling us, right? And the IPL guys
But
are,
one
"We
side
want-
you're
we want
saying
this too."
high altitude, low oxygen,
No, so this is hyperbaric. This is different, right? It's a
and
hyperbaric
they're
chamber.
opposite.
No, so I understand hyperbaric chamber is going to increase your ability to resist injury, right? When you have high oxygen tension in the blood, then your oxygen, it can get rid of all the free radicals, it can decrease inflammation and quickly get rid of inflammation, right? So your body becomes very resistant. Now, high altitude training is a little bit different because you're doing something to increase. So when you're in a normal setting, you'll be stronger, faster. But hyperbaric chambers are used by high performance athletes to decrease injuries, right, and be more resilient. So they can run faster, run longer, and compete stronger, right? So as soon as this very famous soccer player got it, all the IPL guys got it. As soon as the IPL guys got it, I got calls from Bollywood.
Authority.
No, all the Bollywood guys. So all the Bollywood guys, because there's a lot of them who do a lot of high intensity
course.
muscle, this, that, everything.
I think
They all started
everybody
getting
will
it.
desire longevity.
Yeah.
Why not?
Yeah. So
if I can have one in my home,
Yeah.
why not?
Why not? A
Yeah.
luxury
Yeah.
one where you
Can
can
be
have
kept
internet,
in home.
computer,
Of course.
phone,
Yeah.
everything inside.
Like there is a very old research on the telomeres and epigenetic clocks, NAD, mitochondrial science. Since long it is available, but why it took very long to reach in mainstream medicine?
Yeah, so I think that cellular level, and then beyond the cellular level, at the nuclear level, that kind of research was confined to major universities. So most doctors were not exposed to it. But once we started having these tests more available, where you could do a DNA screening, you could see your telomere length, you could see what your chromosomes look like, you could identify where there were alleles that were causing possible pathological conditions. Once that, especially when that you remember the human genome experiment where they decoded the whole human genome, that's when that information became readily available to everybody. And the testing became more available, the machines became less expensive. And so now we know that we can measure telomere length. And I'll give you an interesting story. So there's a very famous person who's trying to extend his life. And that person later came to me and said, it came to me and said, I wanted to get some neural restoration and this and that. I said, well, why me? He goes, well, you're like the brain guy. You're like the brain expert guy. I was okay, fine. But I said, but I want you to bring all your whole medical history, and I will look at it all very carefully. So I looked through his medical history, and I saw a medicine called rapamycin. Now, rapamycin, understand, is a chemotherapy drug.
Yeah.
And is used to kill cells. So I asked him, why are you taking rapamycin?
I think David Sinclair, Dr. David Sinclair has been
talks
talking.
about it.
Yeah.
He talks about it. And see, the problem is, a lot of these guys talk about a lot of stuff, metformin and rapamycin and these, but what they don't talk about is dose. They never talk about the dose.
Yeah.
So yes, it's
That
an
is very
mTOR. It's an
important.
mTOR inhibitor. Rapamycin is an mTOR inhibitor, but guess what? It inhibits 35 other reactions within the body. So one of these very famous guys who was into longevity came to me, and I saw his file, and I said, you're taking rapamycin? He said, yes, I was told that I should do it as an mTOR inhibitor. It is an mTOR inhibitor. I go, but not at this dosage. I said, this is the dosage I use to kill AVMs and other type of tumor tissues. I inject it through arteries into a tumor, or I inject it into an AV
It has to be
malformation.
smaller dose.
Very small dose. So you should microdose. So even now, even with peptides, even with a lot of other medicines, we know that microdosing is much better. We don't want to take a big dose. Even when we inject steroids into parts of the body, I mean, the body secretes its own steroids, right? Through the adrenal glands, but it's microdose, right? The body releases very small amounts. It's the same thing. So I told him, hey, let's just measure your telomere length because you've been taking this rapamycin. And what he discovered was because of the rapamycin, he actually lost 6-7 years of his life because his telomere shortened. And I was like, well, I think you might
When you're saying
stop that.
last 6-7 years of life, so we do sometime crash C-section. And after that, we say we lost 2 weeks of our
Yes.
life. So much stress, so much adrenaline.
Yes.
Yeah.
No, there is when your body goes into that sympathetic overdrive, you actually do. I mean, I don't think you could measure, but you actually lose. You will feel it. You lost some age. You aged rapidly. We know this. So we watch it. U.S. presidents and take pictures of them before they start their presidency and after they start their presidency, and at the very end, and you see there's a huge difference in aging. You see their hair becomes more gray. They have more wrinkles. They've aged rapidly in that 4 years or 8 years that they were president. Because of stress, right? It's stress. It's responsibility. It's all those things, and you're making all those decisions. That kind of thing does age the body, and we know that stress is probably the worst. Stress and inflammation, right? Those are the two things that we're all.
Is it
we consider
stress
enemies.
or is the response to stress?
Yes, well, I think
because
it's-
if you know,
Yeah.
like I know when crash is happening, if I know the right steps and I'm doing it correctly, but still it's the adrenaline rush.
But this is why the ancients taught us meditation and salat and prayer and deep. And when you go into prayer, you go into a very deep level of prayer, right? You go into a deep level of meditation. Then
You
when
have
you're-
researched very well everything.
Yeah, no. And then when you're
Yeah.
at that level, then small things, even big things, don't affect you. You see these in trauma situations. Like, so I've been in different theaters of war through my military background, but because of that, you see there's certain people who are very calm, they're very relaxed, and they're still thinking logically. While the other people are like chickens with their head cut off, running around, they don't know what to do.
Yeah.
They've all so this is why the military always trains people to be. You do everything in a process procedure. Everything is well planned. Number one. Number two, keep your head, right? Firefighters are taught the same thing. Police are taught the same thing. During that trauma situation, during that adrenaline rush, wait, take a minute, stop, slow down, think.
Yeah, training is very important. How you are reacting to the
Situation.
situation.
And that's why this mindfulness in medicine has come, right? Where you think about things, right? And you plan. And in our religion, we talk about that 1 hour of thinking, right? Sitting down and thinking is more valuable than praying the whole night. Why? Think about it. Because you actually think, you meditate, you put yourself in a relaxed state, and you are able to logically think about things. And that kind of planning and that kind of meditation and that kind of, if you can do it, that's why you have yogic masters and you have Buddhist masters and you have Sufi masters, right? These guys, so I'll tell you an experiment we did here in Dubai. So this one Canadian doctor came to me and he said, Dr. Shah, I want you to do functional MRI for me. I'm like, what do you mean functional MRI? He goes, I want you to scan my brain and I want you to see where the blood flow goes. We have this bold technique where it's called blood oxygen level dependency, that we can see where the blood flow goes, and that's where the brain is active. So I said, okay, you come in and do it. So this Canadian guy, and he also had studied pranayama breathing. So pranayama breathing is a specific type of Ayurvedic breathing, and a special Vedic technique that the Hindus have developed a long, long time ago. So he starts doing it. We put him in the MRI scanner. The most amazing thing happened.
Yeah.
He started to divert blood to different parts of his brain. Okay, so I do neuroangios and I inject contrast into the brain. I see the blood flow. I know what blood flow looks like. What he was doing was not normal. He was directing blood to different parts of his brain. And guess where he directed most of the blood? The pineal gland.
Okay.
So the pineal gland is considered your third eye, right? It's also considered a source of soul or a source of spirituality, or, the ancients talk about that third eye there being there. He was able to direct the blood through his breathing technique into his pineal gland. And I was like, so there's a microphone.
Was it breathing or what is
Yeah,
thinking?
no, so both, right? He went into a very deep state of meditation,
deep meditation.
and he started breathing and changing his breathing pattern. And you saw that blood flow going on into his pineal gland. And I was like, dude, what are you doing? He's like, Dr. Shah, shut up. You're breaking my concentration. And I was okay, sorry. So then he went back to doing it. And then he directed blood from the pineal gland to his frontal lobe. And then he directed to his occipital lobe. And you could change
by
it
deliberation, or
by thinking,
it was just happening?
No, by
Thinking.
both deep meditation, and by his breathing technique. And he was able to move blood flow around his brain. We were actually going to publish it. Then we didn't have enough data. We wanted like some of his students, but they were not as gifted as him. So understand the power you have over your body if you use it, and if you meditate, and if you think, and if you think about God and what He's given you, is amazing. We talk about placebo and nocebo effects, right? You know that we've seen it. At MD Anderson, which is the biggest cancer center, I've seen people who are in really a very high spiritual state. They're always happy. They're always thanking God for everything. You can see tumors melt in their body spontaneously. So remember, we had this one guy who came in with this huge lung cancer. We're like, he's going to die in 6 months. Anyways, he was a very religious guy, very, very religious. And he said, no, I'm going to do this, and I'm going to do this, and I'm going to do all this religious stuff, and I'm going to go, and then you can scan me later. So he left. 3 months later, he came back. The PET scan showed no activity. The tumor was there, but the tumor now had no activity. He had killed the tumor spontaneously.
Wow.
So the body, understand the power of the body. This is the hadith that comes from the Prophet, right? That for every disease, I've created a cure. It exists.
Yeah.
He's given it to us. And that's what I say, that's why it's very important to study the ancient medical techniques, because the ancients knew things that we are now rediscovering. But that ability of your body to heal itself is incredible. And that's what stem cell regenerative medicine is, right?
Amazing.
We're usually taking our own stem cells that you have in your marrow or your fat or other places, dental pulp in the brain, in different areas, cardiac stem cells. Your body has the ability to heal itself. It's just a matter of giving it the right substrates and the right, sleep, nutrition, exercise, the right things. You can heal anything almost.
Right. So I will ask question regarding aging. So now we understand many mechanisms of agings like mitochondrial decline, cellular senescence, inflammation. So are we still doing study, or we already started to slow down the age?
Yeah, so I think there are now techniques to decrease cellular senescence, right? So cellular senescence at the cellular and nucleolar level, we can increase telomere length. We can do things to stop certain processes.
So, correct me, we can increase the telomere length, or we can stop losing?
No, we can increase telomere length.
Increase also?
Yes, we can actually increase. We can increase. We have, through certain peptides, through photobiomodulation, through diet, exercise, sleep studies, we know that we can increase your telomere length.
Right.
We can actually cause you to be younger, at least chromosomally, right, on the chromosomal level. But as certain people have said, well, that's just
wrinkles
chromosomal.
reversing, you're saying.
Right. So understand.
Yeah,
some
for
people,
women perspective.
yeah. So some people say that, you know what, Dr. Sean, I may have heard this argument before, that yes, you are decreasing cellular senescence, but the body is still aging. The outside of the body is still aging. The skin is still aging.
Cosmetic aging.
Yes, right. So what I say is, yes, we at the cellular level, we can decrease, and especially, we have something called zombie cells. And you may have heard of this, zombie cells. Those are these cells that are continually causing and creating inflammatory mediators because they should have died, and they don't die. And so one of the best ways to get rid of those zombie cells is fasting, right?
Fasting,
So intermittent fasting or 3-day fasting,
Yeah.
we know that that increases autophagy. And then the body, autophagy means self-eating. And the body will get rid of all those cells.
Zombie
and
cells.
start cleaning up those zombie cells. And we know that once you clean up those zombie cells, well, guess what? They get replaced with young cells. And so you physically become younger. Right, and we know, but all of us know as doctors that for example, your skeleton is replacing itself constantly, right?
Yeah.
Your human skeleton, your skin is constantly replacing itself, right? Other parts of your body, your GI tract is constantly replacing the mucosa within it. And the endometrius is always constantly replacing. The vaginal lining is constantly replacing. So understand the body is made to regenerate. Like the liver, one of the organs it has amazing amount of
power of
regeneration. You can
regeneration.
cut out a part of the liver and it will grow back. It's like the salamander that loses a tail, it grows back, or loses a limb, it grows back. So understand, we have this regenerative capacity in our body. It's just a matter of now moving it to different parts. And I'll give you a little story. We had a cardiology guy, a German cardiology friend of mine. He called me up. He's a general doctor, but his father was in a cardiology unit. And his father had a very severe heart attack. So, you have three main vessels of the coronary arteries, your right coronary, left coronary, and your circumflex. So he got an LAD blockage. So that's his main supply for the ventricle. He lost 70% of his ventricle. His ejection fraction went from 55% normal to 10%. Now we call this a cardiac cripple. That person cannot walk across the room without getting short of breath. That person cannot walk one flight of stairs without getting short of breath. And the doctors, they said, well, you know what, his ventricular damage, other than a heart transplant, we can't do anything for him. He's lost his ventricle. It's not possible. So he called me and he said, what can we do? I said, listen, bring him to our clinic in Mexico, and we will do some things. Which I will tell you, some of it is experimental, and it's an experiment. But if you want to do it, we can do it. So we injected stem cells into his coronary arteries. So I did that. I put stem cells directly into his left coronary arteries, especially the left coronary. So I put extra mu cells in the left coronary. Then we did infrared laser light. So infrared will penetrate the chest wall, right? And it can go up to 8 centimeters down. So we did that laser light. We did use special laser called the RJ laser. We used it on his heart, and then we also did photobiomodulation intravascular, right? So the venous photobiomodulation. This plus peptides, plus exercise, plus cardiac exercise, and his ejection fraction went back to 55%.
Oh, that's great.
Yeah, and so then he went for a scan with the same cardiologist that scanned him the last time, and the guy was scanning, and he goes, this is not the same in German. He's like, this is not the same patient. He's like this, and I go, yeah, it is. It's the same patient. He goes, no, it's not. I go, look at the valves, because when you look at a valve, you can tell, especially if you have the old echo, you can tell it's the same patient. He's like, this is not possible to regenerate the ventricle. You cannot do this. You cannot rebuild ventricular muscle once it's scar tissue. It's gone. I said, no, it's not, my friend. There are ways. Even the heart we can regenerate.
So how long it took this?
So it took 3 months.
3 months.
Yeah, and we did lots of exercise. He
Not
got really good sleep.
No, not much.
We did a lot of cardiac, and he did really strong cardiac rehab. And I'll tell you right now, that man is right now with his wife going through the Alps. They have a small,
Whoa.
little trailer, like
Wow.
those pop-up trailers. So they have a pop-up trailer. They have the car, and he's now hiking in the Alps.
Wow.
Yeah, very good. So, so without hype or without fear, where does longevity science stand today, and what should people realistically understand about it?
So I always say that the basic building blocks are always not changed in longevity science: good sleep, good nutrition, good exercise, right, and good social circle,
Connection.
right? Social connections, yeah. Of
course.
We as humans are very social animals, and so if we don't have good relationships with our social connections, our first degree relatives, especially, and also second degree, then we suffer. Right, we suffer depression, or we suffer anxiety, or we suffer. When you have, for example, in our religion, we talk about you always use counseling. You always counsel. You always ask for advice from a shura, right, from a general counsel. So this kind of social conditioning that we are told is very important. So if you have these basic building blocks, then longevity is easy. Then you choose the right peptides, you choose the right exercises, you choose the right medications, you choose when you have damage, or when you have an infection, or you have something, you respond to it appropriately. And you start doing preventive things, right?
Yeah.
To prevent it. Like you guys did the cryo, that will help you prevent some injuries, right? And it make you a little bit stronger. You stress the body a little bit. You do these kind of things, hyperbaric chambers and other things. So I think in terms of, there's some people who still argue that there's no such thing as longevity science. Well, I would argue that's not true. I think we can increase human lifespan. But the thing is not just increasing lifespan, but increasing health span.
That's
We
right.
want them to be also neurologically intact. Usually we see lots of people who are very
Brain
old.
span.
Right. They're very old, but they have dementia now. So
Actually,
have
that
we have to
thought
have all of
came.
that.
That thought came because suddenly wellness, everybody started talking. But now we see the context. It's historical, it's ancient medicine. Also, Russian experiments, Third World War or the Cold War. So it's not something sudden. It's already been there.
It's been there.
And
that knowledge
it's-
is there, exactly.
And it's being practiced.
And now we're rediscovering that knowledge, right?
Exactly. So if people know that, maybe they will understand. So when they're talking what this wellness longevity is, they don't know history. They don't know the context. They don't know what's been happening already for almost a century.
No, and if you look through the ancient scriptures of all cultures, right? Whether you go to the Vedic, Ayurvedic, the older Hindu scriptures, you go through the Muslim things, or you go through Abrahamic religions, there are many, many instances of people living 200, 400, 600, 800 years, right? This is very common. It's not just common in Islam or in Christianity or the Jewish religion. It's common
the practices.
It's common in all religions that and all cultures.
And
that
it must be practices
but
they're
people could
doing.
live. People could live for a century. People could live for 2 centuries, 3 centuries. It's possible. It's just a matter of knowing and rediscovering that knowledge and using it now in a way that. And the problem in our society is you guys know there's too many environmental toxins,
Factors.
microplastics, bad air, bad water, these kind of things that and infections and resistant infections, antibiotic resistant infections. These kind of things are
COVID
harming
vaccine.
COVID vaccines. Yeah. So if you start me on vaccines, I'm going to stop.
Yeah.
Not stop.
So
But all
in
these things
this-
which are bad for our body, we are dealing with. Before people, and that's why you see like little kids.
Nature.
Yeah.
They were just dealing with nature.
Yeah, no, if you have little kids, you see these little kids who, like in Africa, they had almost no COVID. Why? Because those kids, they are already very strong, right? Their immune system's super strong. They can resist all kinds of things. You know, why does Ebola, it's like 6th time or 8th time in the Congo, it doesn't spread. Why? Because those kids, those people, their immune systems are very strong. They've seen it before, and the immune system attacks it immediately. They say, okay, I'm not worried about Ebola.
Immune
Takes
system
care of
is
it.
like training. How it gets training, it will become more strong.
Yes, you have to train it. And this is why
Exposure.
Yeah, this is why we see that kids who live in houses that are too clean, antibacterial toys and antibacterial this and they're very weak children. The kids who are exposed on the street, you take a little kid from Delhi, or you take it from Lahore, or you Karachi, you take that little kid's immune system super strong.
Yeah.
You can
Yeah.
throw anything at that kid's immune system resists. They are running around barefoot and through the streets and exposed to coughs and colds, and people, they don't get sick. Why?
In COVID, we went Karachi and we were the only ones wearing
masks.
masks. Everybody was just staring at us. What is happening with them?
No. And when I was in COVID, I was working in the ICUs here, and I was exposed to, and I got through COVID 3 times. But first of all, I was taking ivermectin, I was taking hydrochloroquine, I was taking zinc, I was taking a lot of supplement, I was taking black seed oil.
The best thing
Right?
is your own
black seed
immunity.
oil, right? So our own prophet said about black seed that there's a hadith that black seed will cure everything except death.
Yeah.
And we know that the thymoquin in black seed oil is very powerful, very strong stuff, and it will build your immune system so strong that guess what? You resist so many diseases. You don't get sick. Even now, I rarely get a cough and cold, but I'm taking vitamin C, vitamin D, black seed oil, these kind of things, and I'm exercising and I'm putting my body through these kind of things, but I don't get sick that often anymore. It's amazing. And my other friends who are also in the hospital with me, every time they meet a patient, they shake hands with some patient, they have a cold. They have upper respiratory tract. I'm like,
Upper
dude,
RTA is very common.
I'm like, dude, what's wrong with you? And they're like, well, how do you keep on resisting? I'm well, I have some secrets.
So
Yeah,
lifestyle is very important for your
Yes.
health. How you're doing exercise, what
Yes.
you are eating.
Yes.
So basics are not
Yeah.
changed.
Yes.
They cannot be
Sleep.
And
ignored.
being happy, right? And being
Being-
gratitude, right? So
Connected.
gratitude, gratitude to God,
Good
gratitude to the
sleep.
world. Yeah, these are
Yeah.
all very important things. When you're a social circle, right? When you meet people and you talk to people and people enjoy time with you, you know what? That we know creates a positive energy inside of you and makes you healthier. And you see those people who are very charismatic. You talk to them, you meet them, you're like, they make you laugh, they make you joke.
Yeah.
And those people
You should
have
know.
better health than us.
Right.
You should know what to do when you're not doing anything.
Very important.
So yeah,
Very
Yeah.
important.
amazing.
Yes.
You just spoke Russian. you spoke Arabic. Now tell our audience how many languages you speak.
I can speak a few: Spanish, French, Russian,
my
a little
gosh.
bit of Korean.
Oh my God.
Urdu, Hindi, Punjabi.
Of course,
right? Urdu,
they're same.
right?
They're different names to
Farsi,
same.
Farsi.
Farsi, wow.
Yeah.
Then Afghani will be there also.
Yes, I can speak
Because
a little Dari.
people who can speak Farsi, they
Yeah.
can speak Afghani
Yeah, the
also.
Dari form. Yes, I
Yeah,
can
so
speak.
Dari.
Balochi is remaining because
Yes.
Farsi has something.
They're a little different
to do
yes.
with
Yeah,
that.
Yeah. No, I mean,
Amazing.
my parents always pushed me into learning languages. My dad, especially,
Amazing.
pushed me into learning the languages, and he used to take
He
me.
himself used to speak more languages.
He
Wow.
spoke many languages, and he used to take me all around the world. My dad was with the Islamic Red Crescent.
Wow.
He's also a physician, right? So he would take me to different. We went to Lebanon in 1983 during the Israeli invasion. We were in Lebanon, and I was like, and I was learning Lebanese, Arabic from all these guys, and
Wow.
interesting.
Yeah, you're Arabic.
Yeah,
I heard
yeah.
you speak Arabic very well.
And even my children in 4-hour medical school right now, I push them to learn. So they all speak Polish now, and one speaks Farsi because they're studying in medical schools outside of the U.S.
This is the reason your brain is very active. So those people
Being
who speak
multilinguistic is a thing.
multilinguistic is very, very good for your brain.
Yeah, so in general, being a polyglot, if you can speak multiple languages, helps your intellectual capabilities also. We know this. And especially, so I am right now trying to learn Chinese.
Oh my.
That's very hard. Very
You
hard.
have to
very,
take
very
another
hard.
birth.
No, so
You
Chinese.
have to be born again to learn Chinese.
No, because Chinese has 150 characters.
Oh
right?
my God.
And you have to know, or actually, it's, I think 150 to 300 characters that you have
This
to
is the
learn.
reason they don't
to
have
learn
time
language.
to learn other languages.
Yeah, yeah.
150 characters.
No, but
is
that's why they're
enough.
very good at math too. If you
Oh,
notice,
they are.
because most of us have 26 characters or 30 characters in our language. These guys have 150 to 200 characters in their language. They have to learn those to be able to read. So these little Chinese kids, their minds move much faster. You give them a math problem, they're very fast at it.
Amazing.
It's amazing.
So I think Dr. Ayaz and me working in wellness also, and we both enjoyed the podcast.
Yeah, really, it was very insightful.
It was an amazing
and
hour. So now we have a camera audience listening to you.
Yes.
What message you would want to give to them?
Well, I
That
think,
camera.
Yeah, so I'm going to
Yeah.
say, first of all, I'm very happy to both meet Dr. Bushra and Dr. Ayaz, and I think they are and they will be leaders in Dubai in the wellness field, and you should look to them for advice. But I appreciate being here, and it's always kind of basics. Good health, wellness, longevity, it all comes down to following your spirituality, following those ancient knowledges that you can find in the different scriptures, and also talking to people and continuing to get knowledge is always important.
Amazing.
Thank you.
We started today with a simple question. Can the human body be taught to heal better? And the answer, it turns out, is yes. It always could. It was doing it long before we had the science to explain it. The ancient physicians were right. They just didn't have the language yet. Thank you for being here. This is Wellness Must, and we'll see you next time.